8:34, live look at, well, the Amway, you can kind of see it. Downtown, some of our buildings in the skyline lit up red. I promise, it is red. It's just really bright outside right now. It's also because it is American Heart Month, and Friday marks Wear Red Day, promoting heart health through the American Heart Association and, of course, supporting women's heart health as well.
Yes, new this morning, Julie Newhouse with the American Heart Association and Andrea Collins, the Go Red for Women Luncheon Chair, joining us in studio. Thank you guys so much for coming in this morning.
Thank you for having us.
We appreciate your time so much. Of course, we know it's very busy for both of you because you guys have got a lot of events going on this month for Heart Month. First, let's talk about American Heart Month. That's the month of February. It kind of coincides with Valentine's Day. We love the little, thing there. So talk about what this month stands for. Why are we observing it in the month of February?
Absolutely. That's a great question. You know, the month of February is really our Super Bowl, if you will. It's our time to spread awareness. It's our time to get businesses to wear red, not only on National Red Day, Go Red Day, which is tomorrow, but also all month long, just to let people know that heart disease is the #1 killer for men and women, and that it kills more women than all forms of cancer combined, which is startling. And so just really to spread awareness, and we love seeing all the buildings go red and
even though we couldn't really see it there, but I promise.
Absolutely, the building's going red, but of course we're all going red too.
Yes.
Talk about the importance of wearing red for tomorrow, Friday.
Yes, so Friday, and tomorrow. National Go Red Day, so wearing red, and I think it's a power color, right? So we want red to mean go, right? Not stop. In a lot of situations it would mean stop, but to really mean red means go. So go get educated, go advocate for yourself and your own health and learn what you can do, right? And what the symptoms are, especially for women. They may look different for heart disease than they do for men. So really understand those signs and symptoms and support each other.
So the luncheon is sold out. We can't buy any more tickets, which is great. Talk about the support that means American Heart Month does have here. I mean, it's a pretty great thing that it's all sold out, right?
It is.
It really is. You know, we have a wonderful group of professional women panelists tomorrow. We have 4 docs on the panel. We have a cardiologist. We have somebody talking about ages and stages, and we have nutritionists, and we also have a dentist this year that really talks about how the mouth is the gateway to the heart. And I think that the audience and everybody that leaves tomorrow is really going to take away some aha moments and some tidbits of information that can help them as they, travel on to the next age and stage of their life and be more aware and, if you will, red means go. So we're also going to have a passport to wellness, if you will, there, where we can have different activations within the ballroom where people can get healthier and advocate for themselves and others.
Very cool. And that's important as advocating for your own health, right?
Definitely. And I know that you mentioned ages and stages, kind of having that in mind, that our heart health changes throughout our lives, specifically with women too. There's a lot of different changes that happen that can affect heart health, pregnancy, menopause. Can you kind of talk about the importance of all of that?
Yeah. Oh, definitely. And it does. It changes, right? And I think we talk about, getting into it about a couple of years ago, just learning this whole, the facts around heart health and heart disease, that it is the #1 killer of women, and so understanding that even pregnant women can have heart issues, and it is the #1 killer of pregnant women too, and new mothers. So understanding those differences, and our bodies do change, right? We need more research and more education around it because it is different, and we may not have or need the same treatments that men do. And so it's really truly educating ourselves as women, our friends, our coworkers, right? Everybody in the neighborhood, your parents, etc. So it is really important and to understand that it does change, and to stay on top of it and to really learn and be able to be active and know what you can do about it.
Yeah, so of course Friday, of course, is Wear Red Day, Go Red for Women Day. I want to highlight though, because you mentioned it's not just women, it's men too, right? The #1 killer of everybody. Can you talk about the things that people might need to be aware about, especially as heart health is promoted in this month of February? Maybe that be the symptoms and signs to look out for, or how we can be proactive about our health.
Absolutely. A couple of things. One, make sure you know your numbers.
Yeah.
Know your cholesterol, know your blood pressure, see your doctor on a regular basis, see your dentist as well, because oftentimes people see their dentist more than their primary care physician. And talk to your friends too. I mean, we advocate for each other. So if you're going out for a walk with one of your girlfriends and they're saying, gosh, I'm really feeling this way, and you say, you need to go see your doctor. Yeah. There's something else going on. And tomorrow when we're at the event, there's going to be 3 different women and that were turned away because one said you're way too young to have any heart issues. One was saying that it's just menopause. There's nothing else wrong. And really being the biggest advocate for yourself, knowing that if something feels off, you don't stop, that you trust that gut. And it is so important. And also, you know, the men in our lives as well. We talked about menopause, and us women go through a lot of different symptoms and roller coasters sometimes as we're going through those stages. And so I think it's important for them to know how to, you know, best help us and care for us while we're going through those symptoms and stages as well. And so tomorrow is not just about women, it's about men and women supporting each other and coming together for a common cause and going red for awareness and a greater purpose.
Yeah, absolutely.
Yeah. Huge educational aspect for sure. And I know that a large part of that is being proactive, learning hands-only CPR. And is that going to be something that we can learn?
Yes, actually. And I know I don't want to take Julie's thunder, but we are very excited about the event tomorrow. And she got some new dummies, I guess, right, that you can actually learn hands-only CPR, and they're female, so there's a female anatomy that you can learn how to do it, because part of that is the stigma, right, against, like, with women's anatomy is different than men's, and so sometimes with women receiving, you know, less CPR from bystanders, etc., because of that fear, we're trying to get people over that, right? Women deserve the same chance as men. We want everyone to be saved by CPR and not have that, you know, split-second even thought that you need to, maybe I shouldn't do that, right? So we're really excited about that, and I think that's another thing that when the people come to the event tomorrow, they'll get a chance to do that.
Go ahead.
Yes, I was going to say, Andrea made a great point. You know, women receive CPR 23% less than men.
Wow.
That's startling. It's like, why? And we know why. You know, people are afraid. They are protected by the Good Samaritan law. You know, if you need to administer CPR on somebody, they are no longer living right now. So anything you can do is going to help the situation, and minutes matter and seconds matter. Within 4 minutes, brain damage starts if you're not administering CPR. And we know that pressing hard and fast in the center of the chest is going to circulate that oxygen throughout the body because our lungs already have so much of that air. And so tomorrow we're going to have our mannequins, our female mannequins there. We're going to have some fun bras on them too that people can cut off and just really take that stigma away. And we're like, why don't we have female mannequins, right? So we're excited that will be an addition tomorrow as
Absolutely. Let's talk about the stigma of getting your health checked out too, because we've heard from many people over the course. I mean, we've done the American Heart Walk with you guys. We know that there is a stigma around getting your health checked in some aspects. In this month of February, what do you want people to know at home about that stigma, and why, if there's something wrong, you should go and get it checked out?
Absolutely. You know, I think women in particular, because you know, a lot of people are juggling careers, or they're juggling kids, or, you know, travel activities. And I think sometimes we just push that off. And if there's one thing we can tell you to do in February, go get yourself checked out and go do it, because knowledge is power. Knowledge is power. And I love that takeaway, because we need all of the moms in our lives to be around, because losing one woman is way too many. And so if you can do it, if you're not going to do it for yourself, do it for your family, do it for your loved ones, and go get the numbers and go talk to your physician about how you're feeling. And just make sure everything is A-okay.
Yeah, absolutely.
I love how you mentioned, too, kind of being an advocate for yourself as a patient and making sure that you are getting seen, knowing you're normal, and getting things checked out if it's not normal. But how do we know what our normal is? What are some of the signs and symptoms that we can look out for to kind of tip us off to, as something's not right here?
That doesn't feel right.
Sure. You know, sometimes if your heart's racing a little bit, if you're out for a walk and the hills seem a little more difficult. I was just having lunch with a woman who was a survivor and had a heart attack a few years ago. And she's like, you know, I was walking with my girlfriend and I'd get to the hill and I'm like, something is happening. I'm sweating a lot more. And it's cold. She said she doesn't typically sweat. She would feel a lot of racing, and then she'd get to the top of the hill and start walking again. And she's like, would dismiss it. Something like that. go get it checked out. You know, if heart attack symptoms are a lot different for men and women as well. Sometimes for women, we just feel nauseous or just a bit off. And if you're feeling like that on a regular basis, go talk to your physician about it. You know, we don't often have the pain shooting down the arm or the jaw pain,
right,
and the, you know, sharp pain to our chest. We exhibit different symptoms. And so it's so important to know those symptoms. You know, signs and symptom cards will be on every place setting tomorrow to know the difference between men and women. And our cardiologist will be sharing some of that information as well. But just know what those symptoms are to advocate for yourself and go get the help you need.
Well, Andrea and Julie, we appreciate your time. Of course, tomorrow is Go Red for Women Day. So wear your red, support the women in your lives. But also remember, this entire month is Heart Month. Of course, tomorrow specifically, and really, I guess the whole month is awareness for women's health, and not only that, but men's health as well, too. The luncheon tickets, unfortunately, you can't get a ticket anymore. Those are sold out, but you'll have to wait for the next one because I hear it's a really fun event. Thank you both for coming in. I really appreciate your time.
Thank you.
Appreciate it.
Yes.